Welcome to the Business of Medicine podcast from the Southern Medical Association. Since 1906, SMA has had a singular mission: to provide medical professionals with the resources they need to learn from each other, and in doing so, improve the overall quality of patient care. The Business of Medicine podcast is dedicated to exploring and simplifying the varied and complex business aspects of running a medical practice so that you can do what you do best: provide your patients with the highest possible standard of care. To learn more about SMA's many other services and educational initiatives, please visit us at sma.org.
Welcome to another episode of Southern Medical Association podcast through Division of Digital Health and Innovation. We have Dr. Migita from Seattle Children's Hospital with us today. Welcome, Dr. Migita.
We volunteered to be part of this discussion about lean and Toyota production system in healthcare. We're very happy to have you on the line. And so let me start up with our first question. Can you tell us a little bit about what is lean and what is TPS, or Toyota production system?
Sure, Reza. I'd be happy to talk to you about this topic. It's a topic that's very near and dear to my heart. The Toyota production system and lean, and there's lots of terminology that people use both in the healthcare industry and outside of the healthcare industry. Lean really got its name after the Toyota production system was created. And the Toyota production system itself has its roots going before Toyota. Dr. Deming and other industrialists really saw the capability of manufacturing and standardization. And only recently has the Toyota production system found its way into healthcare. Lean is kind of a made-up term. People throw that term around, but really, lean was never a terminology used in the Toyota production system. The Toyota production system originally was headed by a man named Taiichi Ono, and he is really thought to be, by most circles, the father of standardization and really the father of Toyota. And what he realized very early on was that if Japan did not catch up to the rest of the world in terms of automobile manufacturing, then they would no longer have any automobile manufacturing in all of Japan. So there was a real sense of urgency back in the 1930s. And the way he realized he could get to this and become a viable automobile manufacturing force is by looking at the Toyota production system. And that's really has a number of different characteristics. Probably the most important one is standardization. And Taiichi Ono himself said that standardization is really truly the mother of all improvement. And as certain hospitals began to recognize the contributions of Mr. Ono, they realized it could be translated to healthcare, something that at first seems unusual. And some people are actually even taken aback or at times even offended by this concept. But if you think about the Toyota production system and how it really is a set of standards that are designed to be gradually improved over time, it really isn't that much different than healthcare. Because in my opinion, healthcare is really a series of steps that are designed to bring healthcare to the patient, to deliver the correct medications, to deliver the correct care in the shortest time frame as possible, so that the patient can live and survive. So it's really a series of steps to be completed without errors. So it actually is very akin to what industry already knows.
Wow. These are very valuable information. I did not know about that. So let me ask you another question. How do you think the healthcare industries that with our current changes that is going on would benefit from lean and Toyota production system?
That's a good question. If you were to ask Taiichi Ono, well, he's still alive, what is Toyota working on right now? He would be able to sum up all of Toyota's efforts in a few sentences. And what he would say was that Toyota is looking to collect the money from the customer, build a product without errors in the shortest time frame with the fewest number of people, and then deliver that product and collect the money. So how is that like healthcare? Well, what are some of the pillars of quality? One of the pillars of quality from a patient's perspective, and that's really the only perspective that matters, is that the care is delivered in a timely fashion, shortest time frame. The care is delivered without errors. What are errors in medicine? Errors in medicine is equal to harm. And those errors could be the wrong dose of the medication. It could be the wrong test on the wrong patient, or something more egregious like we hear about in the literature and in the media of wrong site surgeries. These are errors. In manufacturing, the errors leads to what we call scrap, or materials that can't be used for the product. But in healthcare, the stakes are much higher. The errors lead to morbidity and mortality. So any hospital system, anyone who takes care of patients needs to understand this fundamental principle of the Toyota production system: reduction of lead times, reduction of errors. And from a patient's perspective, that means we are able to cure them of their disease.
I mean, these are very important topics. I mean, these are something that I guess we are challenging and facing every day. But the way you put it into the perspective, to me, is like we need another talk with you to get into more detail about those. How do you, in your organization, you work at Seattle Children's Hospital, that's correct?
That's correct.
How do you guys leverage lean in your organization? Like, what do you go about that to provide this better patient care?
Well, it starts, what happens in many institutions is they become very enamored with tools. What I mean by enamored with tools is that they look at a piece of standard work, which is really a series of steps and the time it takes to do those steps. And administrators will often drink the Kool-Aid, so to speak, and want to incorporate every lean tool they can think of. And those lean tools, as I said, could be standardization. It could be a Kaizen system. It could be workshops that look for that have improvement goals. It could be huddle boards, or it could be any other tool that Lean or TPS could use. But what institutions often forget is that the tools need to come after the mindset. And what do I mean about mindset? And Taiichi Ono, although he wrote this book really about the tools, what he didn't say is that before the tools existed, there was a mindset of that mindset of, if we don't get better at manufacturing, we'll cease to exist. So you first need the mindset before you apply the tools of Lean. And in our case, and this is not just at Seattle Children's. We had real patient harm. Patient harm occurs all the time. I believe it's the number 6 or number 7 leading cause of death in this country is iatrogenic injury in hospitals. So there is a true need for this. And you must first have the right mindset and build that mindset in your staff. And what that means is you need energy. So the first step is finding a few people who have energy for change, because you must have the synergy of just a few people to begin. If you simply throw tools at your entire staff, you might have some enthusiasm, but what will maintain that enthusiasm, the use of those tools, and the creative use of those tools is really the mindset. And we were very fortunate to have some very forward thinkers who really took this as a long-term goal. Early on in my career, I was able to meet them. And they really built this mindset first. Then they sent us to Japan. Then they sent us to the various manufacturing facilities that are experts in Lean. But without the mindset, it simply won't take hold.
I see. So if physician were to, physician, clinicians, our healthcare providers, advanced nurse practitioners, if they were to learn more about lean and Toyota production system and how they can incorporate this into their daily work operation and kind of try to rethink and change the way they're approaching their patient care. Where should they start?
I think one product, so to speak, and if you think about manufacturing, it's very clear they make a product. But if you could see any product that we do here at Seattle Children's, it would be our clinical standard work pathways. And what these pathways are is they follow the patient from admission to discharge. We start with the literature, the medical literature, and make sure that the recommendations we're making are really born from the highest level of medical literature that we can find. And then we hardwire those recommendations into our clinical information systems, such as Cerner or Epic. And of course, we must follow the outcomes of this standard work. And we do this in PDCA cycles. And again, all of these concepts, they're tools, correct? And they're all tools that come from TPS. But what you start with is the mindset for change. So we have over 70 clinical pathways that we've developed over the last decade. And our uptake of those pathways is greater than 80% across the entire institution. Actually, over 60% of all patients at Seattle Children's are on a pathway, what we call clinical standard work pathways. And we chose that name very volitionally. Standard work, obviously, the mother of all improvement, as Taiichi Ono would say, and we simply call it clinical standard work. So our caregivers, nurses, physicians, respiratory therapists, are all actually implementing Toyota production system tools without actually being conscious of that, which I think is just a beautiful thing, because it's really about improvement and the best care you can possibly deliver to your patients.
So, do you have any message, any suggestion, recommendation for clinicians, for healthcare providers?
I would say when you start learning about the Toyota production system, you must have an open mind. And that's very hard to do in healthcare circles, where everyone in healthcare is intelligent, they're in it for the right reasons, they have altruistic motivations. It's really a beautiful field to be in, and I couldn't ask for more. But anytime you learn something new, there's a threat that people feel that how can we possibly go outside of medicine to learn skills and mindsets that can actually help our patients. And I'll leave you with a story, is that when the Boeing airplane manufacturing, when the Boeing company looked to improve the quality of their airplanes and reduce the lead times to create their airplanes, they looked at Toyota. And what happened is initially many of those people at Boeing resisted. And their rationale was this. The rationale was, how can someone who makes cars possibly have anything to do with making airplanes? Therefore, we shouldn't use the Toyota production system. What do we know now about Boeing? Well, they have some of the most efficient manufacturing facilities in the entire world. They're actually able to make a Boeing 737 in 8 days. In 8 days, they can assemble a plane of that size. This could not have been done without the application of the Toyota production system. But most importantly, it could not have been done without open-mindedness. That a few really forward thinkers could see that you could translate the automobile industry into the airplane manufacturing industry. And now hospitals that are getting started need to have that courage to move what we know about automobile and airplane manufacturing into the healthcare system.
Wow, this is fascinating. This is wonderful. Well, I want to thank you, Dr. Migita, for your time and sharing this information with us at Southern Medical Association and our members. And I believe that this is something that we can talk about more in detail in our next podcast, as our members normally reach out to us and ask if they have any questions. They ask us and the topics that are interested to learn more about it. And I feel like this is one of those areas that we can expand upon and bring more topics and discussion to get into a little bit more detail about each of these highlights that you mentioned. But I want to thank you for your time and sharing this with us. And if you have anything else that you want to discuss with us for our podcast, please do so. Or otherwise, we would love to have you again on our next sort of podcast of the Medical Association.
Well, I appreciate the opportunity. I'm always excited to spread this very important information.
We hope you enjoyed The Business of Medicine. For more episodes in this series or SMA's The Practice of Medicine podcast, go to sma.org/podcast or subscribe to us on iTunes, Google, Spotify, or wherever you get your podcasts. For more information about SMA's mission, please visit sma.org. And thank you for joining us.